Dear friends, I hope you are all doing good. You are healthy, hearty, and smiling, and successful in your sphere of life. I'm Arshad Jamal Ahmed. I'm managing CMCS Health and Medicare Private Limited, a Government of India and Ministry of Commerce registered healthcare consultancy firm. CMCS Health call itself proudly as a global healthcare guardian for the foreign patient who come to India for their specialized medical treatment needs. It is a big question, my dear friends. Any foreigner who is coming to India for the first time for the medical treatment, he's having a lot of unanswered questions, that who is the best doctor for my treatment, what will be the cost of the treatment, which is the best hospital for my treatment, where I will stay in India during my medical treatment. So CMCS Health is a one-stop arrangement that provides all the umbrella services at one point for the foreigners who are willing to come to India for any of their specialized medical treatment. India has become a global hub for the medical treatments for the international patient because of the competency and expertise of the Indian doctors, the best in the class infrastructure, and the latest cutting edge technologies that are being used at the Indian hospitals for the specialized medical treatments of the foreign patient. Second, the cost of treatment is much less as compared to the other popular medical tourist destination like Singapore or Turkey. The cost of medical treatment in Singapore and Turkey are almost 2 to 3 times higher than what we offer them in India with the best specialist doctors. Because of all these things, the first choice for many of the foreign patients, even from the developed countries, is India because of the prompt start of the treatment. You don't have to wait for your treatment to start. We do all the spade work before you're coming to India, and you are informed in advance before even boarding your flight to India. You are fully aware that you are going to which doctor, which is the best hospital for your treatment, what will be the cost of the treatment, what will be the treatment course, and how many days you will be staying in India and how many days you will be staying in hospital. So all this information is, make you empowered when you are coming to India. And as a global healthcare guardian for you, we are very proud of the fact because we look after every need of yours when you come to India for your specialized medical treatment as a guardian in a foreign country. So many people have visited India from countries like African countries like Nigeria, Tanzania, Kenya, Madagascar, Ghana, Rwanda, Uganda, Zambia, Zimbabwe, countries like Madagascar and Cameroon, which speak French. Apart from that, we are also getting patients from Arabic-speaking countries like Iraq, Saudi Arab, Oman, Bahrain, etc. Commonwealth of independent states like Uzbekistan, Turkmenistan, Tajikistan patients, they also visit CMCS Health for their specialized medical treatment needs in India. Over a period of time, my dear friend, we have started this operation in the year 2010. So it is almost 13 years since we are into the medical tourism domain, And when you practice something over a period of time, then you become expert into that. So we have set a benchmark for the quality services that can be trusted by the international patient for their specialized medical treatment needs in India. And I'm having a medical background, my dear friends. I was working earlier with the pharmaceutical industry. I spent almost 2 decades in the pharmaceutical industry. So most of the top doctors in India, they are well known to me, and we enjoy a mutual respecting good rapport with them. And that very good rapport with these best specialist doctors in India, that comes in handy when my patient is being treated by these doctors because of the mutual respect, So we are able to extract a lot of benefit cost-wise and more attention towards the treatment of the patient from these doctors, That comes in handy. Now many patients, they come to India for the solid organ transplant like a kidney transplant or a liver transplant, or even bone marrow transplant for certain diseases like sickle cell disease or aplastic anemia or leukemia, that is blood cancer, or lymphomas or multiple myelomas, that is again a kind of blood cancer, to India. So we are having the rapport with the best practicing hematologists at different hospitals, We are not working as any of the hospital agent. We will give you choices for your medical treatment. We will share all the treatment details even before you board your flight to India. You are fully aware, you are fully empowered, you are having all the information with you about who is going to be your doctor, which are the best doctor for a particular treatment, which are the best hospital, and what will be the cost of the treatment, how many days you will be staying in the hospital, and how many days you will be staying in India for a successful medical treatment. So we are just like a global healthcare guardian for our foreign patient, because it is our job to make them healthy, to get them the best treatment from the best doctors at the top hospitals, and the treatment that is within their budget. That is our job, and we are very proud of this fact. So far we have treated more than 10,000 patients from all across the globe for our international patients for various ailments like bone marrow transplant. I have already discussed solid organ transplant. We have got many patients, scores of patients for kidney transplant. For a foreign patient, living donor solid organ transplant is easier because the deceased donor program is still in a very nascent stage, and there are not enough deceased donor organs for the foreigner who is visiting India. There are certain logical technicalities that you have to be present at the time of a deceased donor organ comes to a hospital. You have to be within the hospital within a very short span, and it is not practical. The patient cannot stay and wait for a deceased donor organ to come to the hospital for 3, 4, 5 months. So the best for them is to have a healthy living donor for a kidney or liver transplant. Likewise, dear brother and sisters, the most common orthopedic surgeries are the sport injuries like a ACL tear or a meniscus tear, or arthritis-induced joint damages like knee joint damage or hip joint damage or the shoulder joint damage. So we are associated with the best orthopedic surgeon who are expert in the robotic surgery as well as arthroscopy, that is a minimally invasive orthopedic surgeries. Many patients have come to us for a knee joint replacement, a bilateral knee joint replacement, or total knee joint replacement, that is called TKR, a total hip joint replacement, or a partial hip joint replacement. Although partial hip joint replacement are very rare. Partial knee joint replacement are common because a younger patient, because of some accident or trauma, they may injure their joint, and in that case we may be doing a partial knee joint replacement. We may be using the cartilages and everything of the younger patient because it does not get damaged during the trauma or the accident. It is the bony part that need to be replaced. We are using the best quality imported implants like the companies like Stryker Biomet and Johnson & Johnson, and the best of the brand the Stryker, which are available in the global market. The cost of treatment in India is quite reasonable as compared to the other popular destination among the global patient like Singapore and Turkey. Secondly, what is the most important thing, Indian doctors, they are using the latest cutting edge technologies. Their expertise is already very well established in treating complicated medical situations, and the multidisciplinary specialty doctors availability in the same multi-specialty hospital also paves way for better specialized medical treatment for foreign patient. That is very important. If a patient comes to us for say kidney transplant and his blood sugar is already not controlled, you cannot do the surgery even at the same time when the blood sugar levels are very high or the BP is not controlled. So the cardiology doctor or the endocrinology doctor, first they will try to control the blood pressure and the blood sugar of the patient before the patient can go for the surgery. So they are the advantages. The practical problem that have been faced by many of the patient, I would request the people who have come to India that please in the comment column you recommend your practical problems that you have faced in India, so that we can take a corrective measure, we can improve upon that part, and the next patient that are coming to us to India, they don't face that kind of problem. So in a nutshell, I will say that you can trust CMCS Health as your global healthcare guardian for your specialized medical treatment needs offshore, especially in India. Have a great day, my dear friends. Bye-bye.